Early Taiwanese under the Qing were not familiar with the concept of hygiene. Japan adopted westernization during the Meiji Restoration. They adopted Western medical and public health system. In 1895, Taiwan became a colony of Japan. The Japanese found that the hygienic problem in Taiwan is serious, which caused many diseases. Many Japanese people died because of diseases. For example, Kitashi Lakawa Yoshihisa, late imperial guard to Taiwan, he died in 1895 because of malaria or cholera in Tainan. Around 31% of soldiers of the imperial guard infected cholera, while 64% of the infectors died. So Japanese government think it is important to improve the public health of Taiwan. The government stationed public health physicians, Gongyi, around Taiwan to cure sickness. According to the regulation on public health physicians were stationed around Taiwan and appointed by Civil Affairs Bureau. They were responsible for affairs about public health and medicine, such as be aware of the spread of epidemic diseases, and responsible for doing health inspection when there is a spread of disease. They were also responsible for cleaning and improve the sewer, popularize vaccination, preventing and cure syphilis, cure the poor, and inspection on dead body, the affairs related to opium and poison. They cooperate with the local police who are responsible for the public health to ensure the public health policy implemented successfully in local areas. Police and public health physicians play an important role in implementing the regulations and related public health policy. However, there were always conflicts between them because of cultural and language differences, so people refused to follow the regulations. The following will use the regulation on preventing plague as example to show the conflicts. According to the regulations on prevention of infectious disease, there were 8 major infectious diseases. If doctor diagnose cases of this infectious disease, they should report to the police office whether the patient is cured or dead. Police who receive the report should implement the disinfection regulations immediately. According to the cleaning and disinfection regulation, with the lead of police and public health physicians, people would clean their house and sewer and garbages. For big furniture, it will be put outside the house for insulation. For the other things in the house, it will be disinfected by lime water. The floors and toilets were also disinfected by lime water. The local officials should also implement a traffic blockade to patients' home and its surrounding or the whole areas. When the traffic blockade is implemented in an area, police should implement the disinfection regulations, while the physicians should patrol and diagnose the patients. They should also explain to people how to prevent the disease. Except police and physicians, no one was allowed to enter the area under traffic blockade. Daily necessities were bought by a specific person uniformly. Health inspection should be conducted on trains and ships. When a case of plague was found, the patient should be taken to the hospital for quarantine. But there were many people who refused to go to the hospital, so they would hide the patients or escape to other districts that have no cases of plague. For example, according to the public health physicians in Fanshuijiao, there were plagues spreading around Taipei, Shilin, Xikou, Jilong, and other districts. Although there were not yet cases of plague found in Fanshuijiao, there would be patients who escaped to their relatives' home in this district. People escaped to other places because they found the quarantine inconvenience to them and they did not believe the Japanese. For example, according to the petition on Stop the Health Inspection, Taiwan people believe that they can survive even without a health inspection before. They also think that the police do not care people's life and just want to get some achievement, so they even identify people who are sleeping as patients. They do not believe that the Japanese can cure them because they do not understand the need of the Taiwan people. According to the suggestion letter from citizens of Dadaocheng, they point out that there were differences in the methods of curing patients between Taiwan and Japan. The Japanese see people who get cold as cases of epidemic disease and force them to hospital for quarantine and cure them with the methods of Japanese. There were less people who can survive. So they urged the government, listen to them, that if the patient get cold, there is no need to use lime water to clean the room because it makes the room become cold and dampest, which is not good for the patient's health. Other than that, there were rumors spread among them that the patients who ran to the hospital would all die. The physicians cut the dead body for taking out their organ, so people call the hospital for quarantine as City of Dying. According to another petition from people, they said that there were officers who do not check carefully what disease the patients get and ask him to drink the medicine, even he only get a cold. People also think that it is a grief to open the coffin to inspect the dead body because the dead need to be naked for the inspection, which is unrespectful for the dead. Moreover, there were also criticism on police responsible for epidemic prevention. For example, someone criticized the police on the newspaper. He said that the police think that the villagers are full, so they bully on the villagers. They force the villagers to give them charcoal and alcohol. If the villagers do not follow, they would beat and scold them. They also treated the people under quarantine as prisoners and also beat and scold them. The epidemic prevention policy of the government is good, but because of the inconsideration of the police to the patients, which make the policy become harmful. This shows that people refuse to follow the disease prevention regulation, not because they lack of hygienic awareness, but because they have criticism on the policy and the police who execute the policy.